A U.S. lawmaker from Arkansas is hoping to reshape America's healthcare system.
4029's Chip Scarborough is here with more on the updated proposal and new reaction from the congressman's opponent. Chip.
Well, Lykyra and Allison, Congressman Bruce Westerman recently announced he is reintroducing what's known as the Fair Care Act. He says it's a piece of legislation that combines more than 75 bipartisan proposals. Proposals the congressman says would expand options for health care and insurance. Congressman Bruce Westerman says many Americans end up losing hundreds of dollars each year in unused flexible spending account funds because of use it or lose it rules. He says his proposal would merge those accounts into what he calls one simple health savings account to eliminate waste. Westerman says anyone with Medicare, Medicaid, employer plans, or individual plans would qualify.
I'm not on the committees that are involved in this, but I think all of us is responsibility as members of Congress to try to work towards solutions on the biggest problems, and healthcare is certainly one of the biggest problems facing our country right now.
Congressman Westerman says the Fair Care Act is also designed to help protect people with pre-existing conditions as well as lower overall costs and help increase the number of people who are insured. Westerman says rising healthcare costs are prompting some hospitals to consolidate or even close.
We see consumers that aren't pleased with the cost of the services they're getting and with the access they have to health care, especially in rural areas like the 4th District of Arkansas. We've got a lot of hospitals that are in tough shape financially.
The congressman says a more competitive market will help drive down health care costs. We asked his opponent, Democrat James Russell, to weigh in on the legislation.
To say that somehow an individual is going to be able to negotiate better prices on these things and have a health savings account adjust for these, that's just frankly disingenuous and completely tone deaf to that reality of most people's lives here in Arkansas.
People in outlying areas often rely heavily on telehealth when healthcare options are far away in distance. The Fair Care Act would make COVID-era telehealth expansions permanent. Russell and his wife own and operate an outpatient mental health care clinic in Little Rock.
Serving statewide via telehealth. So I've seen firsthand the impact that these policies have had and the impact that the insurance premiums have had on people.
Now, Westerman says the Fair Care Act would reform Medicare and Medicaid. It would alter Medicaid by offering greater help to those who don't qualify for the program but still struggle to afford insurance. It would give Medicare the ability to negotiate drug prices and compare insurance plans, which he says would prevent seniors from getting stuck in a one-size-fits-all plan. Lykyra?
All right, good update. Thank you, Chip. Meanwhile, Westerman also addressed recent layoffs and closures at some of our area hospitals. Earlier this year, Baptist Health Fort Smith eliminated its labor and delivery services, closed multiple specialty clinics and inpatient programs, and announced more than 200 job cuts. And just last month, Washington Regional laid off 86 people, saying higher labor and supply costs forced restructuring. Westerman says the cuts highlight a bigger problem in health care, including rising costs and high drug prices. He says the possible solution involves redesigning rural health care delivery through regional systems that connect local hospitals with larger medical centers.